Well, while South Africa might have very low COVID-19 cases at the moment, the pertussis disease infections are now concerning. Pertussis, also known as whooping cough, or perhaps more popularly known as whooping cough. So 147 cases from the beginning of this year to mid-September have been logged. The infection patterns suggesting that sharp increases were between May and September of this year. But let's bring in the National Institute for Communicable Diseases. Its head of respiratory diseases, Professor Anne von Gottberg, joins us via our video link this morning. Prof, it's great to have you with us on the program. Tell us more about this very infectious disease, which is very treatable, as I understand it, by vaccine.
Well, it's preventable, yes, so we can prevent it, and I think that's the message we would like to get out. And good morning to you and the viewers. It's a routine vaccine that is given to all babies, and we're trying to really encourage guardians and parents to remember to check what vaccines do they manage to get during these last 2.5 years, the pandemic years. What did they manage? If there's anything that they didn't have their children get, that they can have catch-up vaccines, because this disease is preventable with vaccinations, and we'd like to make sure that all children get the necessary vaccines to prevent these diseases.
So the number of cases that we've seen now from the beginning of the year to mid-September, 147, how concerning is that?
Well, it's concerning in the sense that I think we're seeing there were very few cases during the pandemic year. So we know that in the last 2 years, very few cases have been reported. We know that the non-pharmaceutical interventions, the wearing of masks and the distancing, etc., not only prevented respiratory infections like SARS-CoV-2, so COVID-19, but prevented other respiratory infections. And so we'd like to remind our clinicians, all the doctors and nurses out there, of pertussis, of whooping cough, to remember how to make the diagnosis, to keep it in mind as part of the differential diagnosis. And we're monitoring it very carefully to see that there's no increased number of cases, that in fact we go back to what we were seeing before the pandemic. So we're a little wary still, just worrying that maybe the cases will increase to more than we were seeing before the pandemic. That's not happened yet. But we're wanting to keep a good eye on that, and I think that's where education of our clinicians as well as the public out there, to remind them that when their children, when their uncles and aunts, when their families are getting sick with respiratory diseases, that not only is it COVID-19, that there may be other respiratory infections, and when they are severely ill or when they notice that they're not managing the breathing and the coughing, to go to clinics, to go to hospitals, to be assessed and to have diagnoses made in order to help their treatment.
Yeah, it's what we've been experiencing over the pandemic years, right, Prof? We've seen over the past 2 years sort of a reduction in things like colds and flu, but that's now changed given that, we've dropped mask mandates and so on. How do we differentiate, and perhaps this speaks to the issue that you've just raised now about clinicians looking out for particular symptoms insofar as whooping cough is concerned, but how do we differentiate between something like the flu, and we've had a few cases here in the office, and a cough has been a big part of the symptoms that people have had, at least as far as the experience that I have. How do we differentiate between the flu and whooping cough?
Interestingly enough, it's very difficult from a symptom, just looking at how you present and the symptoms you have and the signs the doctors can pick up. It's difficult. And so there are one or two things. Whooping cough has an interesting, a sort of a quite distinctive cough, which is why it's called whooping cough, where you cough, you have this real bout of coughing, and then you desperately need some air, and then you whoop in and make a noise. And so I think but that doesn't happen most commonly. So that's what makes us understand, and doctors and nurses identify that, and they say, oh, that's pertussis. But that's not the most cases. Most cases, in fact, present very indistinctly, that they are just flu and viruses and other signs and symptoms. And the only way to really know then is to make the diagnosis using a laboratory test. And that's why we're saying that as we were pushing for laboratory tests for SARS-CoV-2, sometimes when someone presents to a hospital and is severely ill, we are now pushing to distinguish whether it's influenza, whether it's RSV, respiratory syncytial virus, or pertussis. And it's only needed for those that are, for individuals who are at risk of severe disease, who present with severe disease. And mostly the nurses and doctors will know that we're saying that then it is important to test so we can differentiate, and that can help in working out how to manage these individuals.
Right. It'll help in giving the right treatment. How dangerous is it, Prof, whooping cough?
Well, whooping cough, like any of these infections, can result in severe disease. So I think we don't want to belittle the fact that it might be a common disease, and that's why we're vaccinating. I think we're worried a little that vaccines coverage is a bit lower because people didn't present to hospitals and clinics for vaccinations. So we're thinking that we want to take it seriously. It doesn't have to be dangerous, and especially if you've been vaccinated, the clinical course is less severe. You may still become ill, but you shouldn't have severe illness. And individuals who are at risk. And so the other thing that happens when we make the diagnosis of pertussis is the Department of Health, because it's a notifiable medical condition, they will come in and they will check for close contacts that are at risk, and they can be given an antibiotic that will protect them from this current infection that a close contact of theirs has had. So there are ways of trying to prevent disease in close contacts, to prevent severe clinical courses. And I think that's why we'd like to just remind clinicians, nurses and doctors out there to keep this infection as part of their differential diagnosis.
So, Prof, if I'm 40 years old and I perhaps haven't been vaccinated, can I still be vaccinated at this point?
Yes, in fact, there's booster doses that can be given and that are considered as part of sort of ensuring that we boost that vaccine response. And it's happening more and more globally. The one vaccine component for pertussis that we're using doesn't last very long. It lasts for 3 to 5 years, and it's given to those that are most at risk for severe disease. But definitely, I think anyone who's concerned, who has risk factors, to prevent your clinicians, your GPs, to discuss what other vaccines might be important. And I think we're learning more and more that adult vaccines and vaccines that are given to adults to prevent certain diseases are becoming more important. And I think these are discussions that should definitely be had by individuals with their GPs.
Yeah, certainly. Some very valuable advice there. Professor Anne von Gottberg, let me thank you for your time this morning. Head of Respiratory Diseases at the National Institute for Communicable Diseases.